Good evening, everyone. Thank you so very much for coming to our first edition of the spring semester of the Alumni Bear Talk series. I would like to welcome you all this evening with our special guest presentation by Dr. Annika Sinha. So I'm going to go give you a little bit of her brief bio tonight. So Dr. Sinha graduated from Mercer University in 2015 with a BS in biology and minors in chemistry and art. She then graduated from Case Western Reserve University School of Medicine in 2019 with her MD and is currently a second year resident in the Department of Obstet- look, Obstetrics and Gynecology, OBGYN, at Cleveland Clinic in Cleveland, Ohio. She was always interested in nonprofit work, including Mercer Prosthetics in the Orthotics Club during college, and is currently leading her own clean water access nonprofit organization called Billion Bottle Project, which she started in medical school. Since her time at Mercer, her interests have always been diverse, from painting, cooking, and enjoying Netflix regularly to publishing manuscripts and presenting at conferences. And her newest focus includes working with marginalized health populations, primarily the LGBTQ plus community, and her future career direction will likely include female pelvic reconstructive surgery and urogynecology, with a special interest in transgender surgery. Her experience at Mercer sparked significant personal and professional growth, and her hope is to share her stories and inspire another Mercer Bear. So I'm going to give you the opportunity to listen to our speaker tonight. 1 second, please.
Dr. Booker, thank you so much. That was a wonderful introduction. Hi, my name is Annika, and I'm just going to talk a little bit about how my journey through Mercer influenced my medical journey, as well as my special interest in transgender medicine and kind of what I did along the way to get where I currently am. This is supposed to be more of an informal talk. We'll leave questions for a little bit later towards the end of the presentation, but of course, if anything comes up, please go ahead and put it in the chat and we'll address it as things come up. And then here's our ID, but clearly you guys have all joined the meeting. Alrighty, let's see. All right, so like any good scientific talk, we have to have learning objectives. It's kind of hard to come up with learning objectives on a PowerPoint about yourself, so I tried my best. But I wanted to start with like who I am, what I did at Mercer to kind of get me where I currently am. When did I get specifically interested in academia and transgender medicine, and how Mercer played a part in that, as well as where I'm going with my career, and then of course, why Mercer is still so important to me. All right, so who I am. I was born actually in the UK. My parents are both physicians. They ended up training in India and then moved to the UK for training there a bit, and then I was born there. Because of their medical training, we moved around a lot. My dad did his training in New York. We lived in North Carolina for a while for my mom's training, and then we eventually moved to Georgia. So my hometown is actually Vidalia, Georgia. It's about an hour and a half away from Macon. I went to a small private Christian school for most of like most of middle and high school. I was a normal high school kid. I played soccer. I had a wide variety of extracurricular things that I like to do, including playing piano. And like any good kid, I applied early to Mercer and I was able to get in. So I actually went to Mercer with the hopes of completing the guaranteed acceptance program for Mercer Med at the time, as well as being part of the honors program. And that was back in 2011. And here are just some pictures of me during that time period. So I kind of wanted to walk through what I did at Mercer from each year and how each year helped me get to my residency and what I've been doing today. And so when I started in 2011 at Mercer, it was actually kind of an interesting situation. I was on crutches. I had just had like a soccer injury. And even besides all of that, I had a lot of fun my first semester. But it was a huge shift for me personally. I came from a school of maybe 300 people total. And then my graduating class in high school was 12 students. And so coming to Mercer was a huge culture shock. The classes were a lot bigger. Obviously, you're doing a lot more work in college. And my biggest transition, I think my first semester, was learning how to adapt whatever coping and learning skills I had learned in high school to how to do that successfully at Mercer. And I think my professors were very integral in making sure that happened. I also started doing a lot of the extracurricular activities that I continued throughout my 4 years. I started it probably my fall, like late fall, early spring semester of my first year, and I would recommend that. Things that I ended up doing at that time, I did student admissions team, ICE, which I don't think exists anymore, but it was the Indian Cultural Exchange at the time, the Mercer Pre-Med Club, whatever I could kind of get my hands on that other people that I knew were doing, I was trying to get in with. And my goal was to continue doing that throughout. Having now been on the other side of applications and admissions for medical school, because I worked on those processes as I was in med school, having like longevity in your extracurriculars is way more important than having a large quantity of extracurriculars. And of course, I started doing research pretty early too. I started it probably the second semester of freshman year, and this was my first Bear Day project. This is the first poster I ever presented in my whole entire life, and it was awesome. Mercer does a great job in kind of getting your feet wet in academia and what it means to look at data and look at articles in a critical sense. And you are able to do it every year on a small scale, which then helps you build skills to do it on more of a national level. So that was really great. And I started getting plugged in with that. And most of the connections I made, honestly, for research and for other things were through the professors I was taking classes with. I didn't like specifically cold email people. But this was a project with Dr. Smith, and I happened to be in his biology class. Um, and then kind of moving along, I think second year was the year I kind of started to figure out what I wanted to do, who I wanted to be, and what things actually interested me. Because I think the first year you sign up for literally everything, and then slowly you start to realize that maybe not all of these like activities or these functions are really worth the time that you're spending doing them, because the work in college just progressively increases, the difficulty increases, and as someone who was thinking about medical school, like maintaining a good GPA even earlier on is really important. Um, so this is when I started working on MPOC, which was the Mercer Prosthetics and Orthotics Lab, which I don't know if it's still in existence today. But we actually, me and a few other people really kind of spearheaded it early on. So this was a club that came out of the engineering department. We were working on building and designing low-cost prosthetic devices to go to Mercer on mission Vietnam and fit people over there. At that time, they didn't have a standalone clinic. Um, and so my role in this organization was not super hard. I was the treasurer, but it slowly evolved into something more. And this is one of the first kind of like presentations and things that we had at that annual like extracurricular day. And I didn't realize at the time how important this would be to me and how important this would be for my future career. I was really lucky that I was a part of it. And honestly, I was only a part of it because I went to a meeting and I asked if I could do something more than just sit around and listen to meetings. And I think having that initiative was really helpful. I think the first fundraising thing I did was I sent letters to like people's families about asking for donations. And I think that really helped the people in the organization feel like I was actually motivated since I wasn't a BME. And that was probably my first exposure to working with nonprofit organizations, co-running a nonprofit organization, and also thinking about how nonprofit organizations really intersect with marginalized health populations, especially with this population in Vietnam. Um, this was the year I really started studying for like pre-med stuff in the sense of making sure that I kind of understood biology and other things that were, commonplace, as well as I think I did actually start like your courses and things. And I know people will ask, like often ask me kind of what I did for like MCAT studying. Kind of did actually start at my second year. Not a whole lot here and there, but it was just good to kind of get familiar with the material. I know the test has changed a lot since then. And then I started looking into other interests. One of the things that I didn't realize was so valuable was the fact that Mercer wants to create students who are well-rounded. We could be great at biology, math, whatever your degree is, but also most students, if you notice, have other things that they like to enjoy and like to do. And those are the things that make people really interesting. I was part of the honors program, and I really think the honors program kind of kicked off my my sophomore year. So we went to, like, this was a class we took with Dr. Hirschberger. We went to England. This was like a class on like C.S. Lewis, and I got a lot of questions about it later on when I was interviewing and what that meant to me and why writing and art seemed to matter to somebody who wanted to do medicine. And then this is where I kind of, you can't really see it here because the flag is covering it up, but I decided on my path, which at that time was, um, I was going to do biology as well as chemistry and art. And I made a pretty adamant point to add art as a degree. I think it's really cool when you have hobbies and interests that you have on your application. But what was really stand out in my application when I was going through this process was the fact that I spent the time to get like a formal degree, even though it was a minor, in something outside of STEM, showing that I was willing to put forth the effort of learning that material, even though it wasn't something that necessarily I would see later on. And I got a lot of questions, probably more questions about my art minor than I ever did about anything in biology or chemistry, to be honest. And then um, third year, so a junior year of Mercer, I was kind of coming to my own. And this is when I actually presented in my first national conference. So remember when I was doing MPOC, that was a nonprofit organization. We applied for the Clinton Global Initiative University Conference, and we actually were able to present. So this was like some propaganda they had of me at the conference. They used it for like later on too, for a grant I later applied for my other nonprofit. So that was actually really eye-opening. I was definitely scared, but something I would encourage anybody who's thinking about a career, possibly in a leadership role, is to start this process early. It's a lot easier to now present and talk to people on a larger scale, knowing that when I was younger, when I was like 19, I was, or maybe 20, I don't even know, doing all of these things, and I had done it before. And I don't know if I gave the best presentation at the time, but it was a huge thing from going on for like obviously my application, also for kind of your own self-development. And then I also, like with art, I formalized my interest in writing. I ended up taking a job as one of the ASC writing tutors. People asked about that a lot. Not only did that help in writing all the applications I had to do, and then later on, it still helps me today writing like publications and kind of knowing a little bit more about how writing scientifically and writing creatively should work. It's just interesting to have a job that not only focuses on an interest of yours, but you're actively helping people educate and learn, which is something that in most fields you'll be doing from now until forever. You'll always be teaching people who are younger than you. You'll always be trying to help people move forward, and having some formalized direction in doing that is actually really helpful. And I think I finished my MCAT my junior year. Uh, it's helpful to get the MCAT done early as someone who's been on the other side. A, if you have to take it again, which is totally fine, it happens often. And then B, you already have kind of a baseline of how you're doing. So if there's anything additional that you need to do to help boost your score, you have that flexibility of doing so. Sometimes people who have taken the test a little close to the application deadline, especially now that I've been like reading applications and things, it just makes it a little difficult, and maybe the cycle doesn't go as well. And I don't think there's any harm in, if the test is not going the way that you wanted to consider taking some time to improve that and focus on something else for a year before you apply. And we can talk a little bit more about that and strategically how that works. I will say I went to CASE, and most of the students in my class actually did take a year off before they went to medical school. I think I was the exception. I think there were only a handful of us that actually went straight through. And I think it actually helps your application a little bit more. And then, of course, I, at that time, applied all over the country, and then decided on going to CASE for medical school. Just a little plug for CASE. Awesome school, absolutely loved it. It has more of a self-directed curriculum. So if you're someone who's a self-directed learner, it's a great place to be, because you're not only doing medical school, but you're also teaching yourself and teaching others while you do it. Very helpful for when you're going to be an attending or a resident later on, because all medicine is one person who has been in it for 30 years, teaching someone who's younger, who's then teaching someone who's younger. So being in a place where you can continue to facilitate growth and learning in your juniors, and having that structure already be in place, even on like the more educational, like, or the preclinical learning areas, makes it a lot more helpful. And so I graduated, and then at that time Mercer started, Case started really early, so I like moved to Cleveland in June, and that's where I've been since. I wanted to a little bit touch on my second point, which I think I've been kind of sprinkling in here and there. But how did I get interested in academic medicine or academia at the time? Because I wasn't like for sure going to medical school until like a little bit later in high school, but I didn't really know what that meant, right? I applied and then I was like, well, that's kind of a cool idea. Let's see how it happens. Like I said, I started in year one, and it's hard. It's really hard early in college to know really what it means to be in academia, and what it is to critically assess other people's work and your own work, and how you contribute to like the larger body of literature, like why your work is important and why someone else should listen to it or read it, and looking at what data and what literature is out there and seeing how that can apply to yourself and being critical of it. Not everything that you read is going to be well written or well studied, but being able to recognize that and always having this element of curiosity and a little bit of like being a little bit of a skeptic when it comes to what you're reading, I think has helped me further on. And it's a trait that I developed really early in college. I definitely didn't have it in high school. My mentors who I have, hey, there's Dr. B. I had so many at Mercer, but here are a picture of some of the ones that I've highlighted just because I could find their picture on the internet and I love them. These people were amazing. I really missed my time at Mercer because I didn't realize at the time how close you can get to these professors and how much they want to make sure that your goals, aspirations, dreams actually come to fruition, and they really do help you get there. I remember Dr. Klepper, when I first started my freshman year, I was really not great at chemistry, which is obviously an important course, and like you have to do good in it to go to medical school. And I went to her office hours and she sat down with me and did all the homework problems with me, which she didn't have to do that. She could have taught me the first one and then I could have like figured the rest out. And those kinds of connections are not that easy to come by, but it's really easy to come by at Mercer. So I do encourage you students who are listening to really take advantage of that, because it's not necessarily like that after you graduate. Dr. Smith, someone who I have been in contact with even very regularly after I graduated, I primarily worked in his lab, and most of my research in college was through the Smith lab, which was always awesome. It was a great learning experience. He helped me figure out why I was doing the research and why it meant something and why anybody would care about it. And I think that was learning from someone who had done that for years and years and years, and figuring out why they ask a clinical question and how they answer it was really important for me when I then went to medical school and started thinking about doing research in medicine. And of course, Dr. Bokros, amazing, helped me so much navigate the medical school applying process, as well as gave a lot of support. As it's not easy being in college, you're by yourself oftentimes for the first time and trying to figure out how to make big decisions that may affect the rest of your life. And I remember numerous times being in her office, just being very confused, and she was always there to help and guide me. And then lastly, Dr. Walker, who really helped my creative writing and the writing aspect of what I like to do, which has still helped in all of my manuscripts now. He would write so many comments in all of my papers, not all good. Some of them was a lot, the most of them were a lot of constructive criticism, but I appreciated this, and I'm a better writer today for all of his work. And there were so many more that I just couldn't fit on this PowerPoint, who have been really instrumental in getting me where I am. And really, I think the focus of all of this and why I was interested is because these people and so many more made me ask questions. It's easy to just take something in and say, oh, this person said this, so this must be true. It takes another step to say why. And having that curiosity was always really helpful going forward. And then obviously I can't forget the person who introduced me to what I want to do today. Dr. Hensel, as many of you guys know, some of you are in her class, was the reason I got interested in transgender medicine. So I took her course, I want to say my junior or senior year. I didn't know anything about transgender medicine beforehand. I grew up in a small town of 10,000 people. I didn't know anybody who was transgender. My first transgender friend was actually at Mercer. I remember reading these books and realizing what a spectrum gender and sexuality resides on, and thinking to myself, my entire view of this has always been very linear, and it doesn't seem to be that way. She always asks us why, and I'm sure you guys experience that too, like why we think what we do, or why these people were treated a certain way. And I really thank her for the amount of curiosity she instilled. My final, I guess like final paper in that class was actually on transgender surgery. So I focused on both male to female and female to male pelvic reconstruction, as well as talked a little bit about hormone therapy, not realizing prior to this class that giving hormones can actually change the physical appearance of someone's sex, and not realizing the importance of this work, especially in the time period that we're living now. And I really do thank her for that. And I wanted to just take a brief moment to talk a little bit about what transgender health is, transgender medicine specifically as well. But before starting that, just to make sure everyone is on the same page, I wanted to go over a few definitions, important definitions of why we think about transgender health as we do. So sex, as many of you know, it's based on someone's anatomy and biology, chromosomally or anatomically. Gender identity is not based on this. It's based on someone's innate identification of who they are as a person. And that's very different. Broadly, transgender is used as a term to identify someone whose gender identity or expression is different from their assigned sex at birth, which is often based on their anatomy or biology. And then, of course, female to male is someone who identifies as female at birth, who has a gender identity of a male, and then vice versa for male to female. Of course, I think even with these definitions, there's a caveat. Not everybody fit into this binary category of female to male. And I think it's really important. And it's really important for me going forward, taking care of these patients to like understand that. And people's gender identity can be in flux, and that's okay. Let's see. Oh, perfect. So a little bit more about transgender health in the US. So approximately less than 1% of the adult population identifies as being transgender, according to data collected in 2016. However, I do believe we have to consider that maybe this data is a little skewed. It's actually really hard to identify as transgender, and often these were patient-reported data. And so unless someone is comfortable in identifying themselves as such, this data can be skewed. And it's something that we do see as someone who has been transgender their entire life and then reveals it more publicly later on. The largest barrier that we've seen and that studies have seen to reporting as well as good transgender healthcare is the paucity of knowledge providers. there are not that many providers in the United States that actually specialize in transgender care, which these patients require the base state health like needs that cisgender patients require, but they also have many specialized needs related to their transition, which not include like physical, mental, surgical, cosmetic, as well as hormone specific therapies, which then have specific repercussions for complications, side effects, all of those things. And if someone is not skilled in understanding or familiar with understanding those nuances, it can be actually pretty difficult to manage someone who is transgender. For example, patients who are on transgender hormone therapy, often their lab values are abnormal. It's not abnormal for them. It's because lab values are actually constructed based on data of cisgendered people. And so people who are on hormones do have laboratory changes, but that normal reference is actually not in regards to them. So what could be normal for a cisgender patient may not be normal for a transgender patient. Similarly, the way that we interpret different results, whether it's imaging or it's like pathology results for transgender individuals, does change based on the hormones that they're exposed to. And we have to think about it in that kind of category. Just because someone now identifies as male doesn't mean that the risk factors and things that they have by being assigned female at birth disappear. And oftentimes they can be exacerbated by the hormone therapy that we're giving, as well as any surgical technique that we do does have repercussions. And making sure providers understand the anatomy is really important, because the anatomy on the outside doesn't necessarily reflect what you think would be on the inside and development as such. Um, and then I thought this was a really interesting chart. In the US, only about a third, like more like a quarter of people actually know a transgender person. Interesting, even this day and age. Let's see. Ooh. So we talked a little bit about barriers to transgender health, which is what my current goal is in addressing. I do believe there's some inability to diagnose gender dysphoria, which is when it's, I guess you could say, the medical diagnosis earlier. Oftentimes it comes from societal norms, stigma, as well as difficulty in understanding that for a patient, understanding that they may be transgender. If it's not something that we talk about, it's not something that someone will necessarily identify with unless someone tells them. For example, if you're not exposed to it, how would you know? Most health insurance plans that are private often don't cover the costs of these interventions, which is really quite sad. Gender dysphoria is a known medical diagnosis in the DSM-5, which is a large book of conditions that the American Psychiatry Board routinely routinely looks at and reviews and considers. These same categories, depression or anxiety and things like that, which are very commonplace, even though gender dysphoria is on that same sort of, I guess you could say, tier. Insurance companies don't necessarily see it that way. They think of these procedures as elective, which is really saddening given that it's not elective for these patients. They need this therapy, this surgery, to make sure that we can affirm their gender. And these surgeries and these services are really expensive. Obviously, thinking about the surgical aspect of it, OR time is expensive, and the cases are complex, requiring many specialized surgeons, as well as the cost of long-term mental health services. Transgender individuals are more likely to suffer with depression, anxiety, substance abuse. And oftentimes, even the W path, which is the overarching, I guess you could say, guidance board that helps us treat and manage transgender patients, recommends a certain amount of screenings and psychological testing before pursuing gender affirming hormone therapy and gender affirming surgery, even those things aren't necessarily covered. And so that's been a problem. It's getting better. Oftentimes, I think Medicaid is now covering, but not so much private insurance. Let's see. The lack of competent knowledge, compassion providers. A huge lack, because a lot of it's not something that was very well known probably 10 years ago. And it does require, even this day and age, there are programs that are developing for transgender medicine as well as transgender surgery. They're up and coming, probably within the last 3 to 5 years. And just the essence of how new it is, we just don't have enough providers who are comfortable and um, who are comfortable and knowledgeable enough to take care of our patient population, which is increasing by the year. Annually, the number of transgender individuals in the US is increasing as people become more comfortable with coming out, and as more people understand what it is to be transgender and can more identify with that. Um, and the training opportunities are limited too, just in the essence of how new it is. So if someone is interested in transgender healthcare or transgender medicine, it's really important to seek out mentors and providers who have done this before, because that's the main mode of learning currently. Not all hospital systems have transgender care. It's usually at larger university programs, university associated programs, often in bigger cities. And of course, for where I live or where I'm from, in Georgia, there are no nearby centers of excellence for it, or even clinics, really. I think there are some in Atlanta, though. And then I wanted to talk about where I'm currently going with my career. Um, I talked about Case. Case was great. Case was self-directed, so I was able to actually start a nonprofit of my own. I think, of course, there's some sort of giving back component in medicine. That's a big reason of why I did what I did. But I also really loved the kind of impact I was able to make with MPOC. And that wasn't something I was able to carry to Cleveland. So I was able to create a nonprofit called the Billion Bottle Project. We're working on inventing clear water technology to help improve solar disinfection techniques in impoverished countries, which is really cool. We've been getting grants and our patent is pending. I'm still doing work for the organization, even though I started my first year of medical school. I didn't realize how much being part of the nonprofit world would help um, kind of my approach to grants writing and conferences. Conferences, obviously, I went to that one when I was in college, but also got really good at applying and receiving grants, which helps out later on when you're thinking about scholarships and grant applying for research grants. And this is the time during this process, I decided I was going to go into OBGYN. Obviously have a passion for women's health, but it's one of the specialties that actually allows for a lot of pelvic reconstruction, which really facilitates learning for transgender surgery. So it's definitely one of the options of how to get to being a transgender provider, if that's something that you're interested in. There are other avenues as well, I guess surgical avenues. And we can talk a little bit more about that in case someone has any questions. And so I matched at the Cleveland Clinic. So I have been in Cleveland for about 6 years. I've gotten really used to the cold. We have a really strong LGBT plus medicine program here, as well as a new transgender fellowship. We actually just started this year, going to show you how new all of this stuff is in the realm of medicine. Kind of going back and looking back at the first presentation I ever gave in college. I actually gave my first transgender research project presentation this year at one of our national societies, which was really cool. And I felt much like I felt when I was in college, nervous and scared, but had the resources and was able to do it. So it's kind of a constant learning opportunity. And then still doing a lot of research in obviously obstetrics and gynecology. And my plan, like Dr. Booker said, is to do urogynecology, which is just kind of a short term for female pelvic reconstruction in urogynecology. Basically, we operate in the vagina, bladder, in those spaces, and also help with incontinence and other things and prolapse symptoms. And then kind of piggyback off of that training, since you've already really well established like your learning and your knowledge in that region of the body, it makes it really easy to facilitate transgender fellowship because you understand the spaces really well. It's a long road though. Your OBGYN residency, so medical school is typically 4 years, unless you're doing an accelerated program. Residency ranges from anywhere from 3 to 7 years, depending on the specialty. For OBGYN, it's 4 years. And then urogynecology or any fellowship after OBGYN is 3 years. And then your transgender fellowship is another 1 to 3 years, depending on the program. Closer to one though. Um, and I wanted to kind of uh, focus on why Mercer was so important. I think this is what I want the big takeaways from this presentation to be. I mean, you learned all about my life and how I got to where I'm going, but I wouldn't have done it without Mercer. And you guys have access to an amazing support structure. So I highly encourage you guys to utilize it. I came from a small school in really the middle of nowhere, and didn't necessarily get challenged to do all the things that now I'm so thankful I was challenged to do, until I got to Mercer. And your professors and your TAs and anybody, your mentors and those in administration and leadership are so wonderful in making sure that you're really not settling, but you're really trying to expand outside your bubble. And so if you haven't found a professor or someone on campus that you have like a meaningful relationship with, it might be worthwhile to think about getting one. It's not that hard, actually. Everybody's friendly. And you'd be surprised how much a cup of coffee will mean to you 5 years down the line, because I'm still having coffee with the people that I met with when I was 18, which is really cool. Um, ask early. I think when you first come to college, there's always a tendency to just kind of get your bearings and figure out what you're doing. It's like a huge change. And there are a lot of questions that come with that. And I really truly believe there's no such thing as a stupid question. And there's nothing too early to ask about. Like, if you want to think about your career, maybe you should ask about that. Maybe you should ask somebody in the advising department. There's no too early for these things, because you'd be surprised how often like these tidbits of conversation actually do end up planting a seed. And later on, those conversations are what you remember, and how those conversations can help guide you when you're making bigger life decisions. And I really encourage you guys to find a focus. For me personally, it was underrepresented health communities and health disparities, whether it was with MPOC, with those patients in Vietnam who weren't necessarily having access to good prosthetic care now, which is like Billion Bottle Project, where I'm working on clean water for those who don't have community-wide infrastructure. And then, of course, even more so working with transgender patients who don't necessarily have the access to healthcare that we have, because of the stigma and how marginalized it's been for them. And lastly, I really truly believe your college experience is what you make it. I think all this stuff is really focused on what I did in my education and what I did like professionally. But I had a lot of fun at Mercer. I made really good friendships. All my friends are getting married. It's great. And I'm still in contact with those people and those friends. And I had a lot of fun while I was doing this. This is not something that you should stress about or start making a list to consider all the things that you need to be doing tonight to get to where you want to go. I don't mean that at all. It was Mercer allows you to have that balance. So I really encourage you guys to think about it in that way. Whereas maybe you're doing all these fun things, and then one day you have coffee with a professor to try to facilitate a relationship. So maybe when you have to ask for a letter in like a year and a half, they actually know you a little bit, and that letter means something. It's just little things like that. As we form these connections, you don't realize how much it helps, but it really truly does. And it helps later on too. Those same skills of making those connections. I was really shy in high school. I don't think I'm particularly shy now. And I think I can have that to thank for it. And this is a picture of my cat. I got her this year. Her name's Torty. Yesterday was her birthday. It was exciting. We had a lot of fun. But she's the love of my life. And I wanted to show you guys that. But I thank you all for your time. It is a little weird to talk about kind of my journey through Mercer and how I got to medicine, all this stuff. I don't necessarily feel like I'm old enough to be doing this yet. But I really appreciate your attention, and I'm glad and happy to answer any questions that you have or any comments or concerns that you have. And I thank you so much for listening. And then Dr. Booker, you can take it away.
All right, that was oh wow, that was amazing, 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 amazing. So much great information, so much wealth of experience. And don't be afraid to share your story because your story inspire others. And I know that all your professors were so glad to see all their hard work has really, really paid off and a successful student and now a successful doctor. So what I want to do now is turn it back over to the chat function. And so what I'll do is Dr. Sinha, if you want to just pull some questions from the chat that you want to answer, we can go in order and then we'll stop recording at that point right now so we
Right.
can answer our questions.